Hello, everyone. In this video, I will be going over solution-focused therapy. So let's begin with philosophy and focus of treatment. So solution-focused therapy is future-focused. Rather than focusing on the past and the origin of problems, solution-focused therapists look at what is working in the present and what can be done moving forward. It is also goal-directed, and it encourages the client to develop their own vision of the future. The therapist is there to offer support as the client determines their skills, resources, and abilities, and which ones are needed in order to achieve their vision successfully. Solution-focused therapy, as you may have guessed from its name, focuses on solutions rather than on problems. So rather than looking at the problems that brought a client to therapy, the therapist and client will focus on potential solutions for achieving the vision of the future. And finally, solution-focused therapy focuses on developing and achieving the client's vision of solutions. Basic assumptions. So first off, the future focus reflects the basic belief that problems are best solved by focusing on what is already working. The solution to a problem is found in, quote, exceptions, or those items when one is free of the problem or taking steps to manage the problem. This means that no problem is constant. You just need to find the exceptions and do more of those things. This form of therapy encourages individuals to imagine the future that they want and work collaboratively with the therapist to develop a series of steps that will help them achieve their goals or achieve that vision. This involves identifying how a client would like their life to be, rather than focusing on the past and dwelling on their problems or the origin of their problems. There are also some important basic assumptions about the client specifically that matter in solution-focused therapy. First off, it's grounded on the optimistic assumption that people are healthy and competent, and that people have the ability to construct solutions that can enhance their lives. Their problem-focused thinking is what's preventing them from recognizing the ways that they've dealt with problems. But if they can move past that to see their resilience and their resources and their skills, then they can develop and use solutions on their own. People have previously solved many problems, and they probably have some ideas of how to solve the current problem, meaning that people already know at some level what change is needed in their lives. They just need to want to change and be supported in that change. The other assumption that's important, and one that we've seen before, is that clients are viewed as the experts in therapy. They're the experts over their own lives, and accordingly, they must develop their own goals and their own solutions. Next, some key concepts. So I've talked about solutions already. This is a key concept. We're looking for previous solutions. So consistent with the strengths-based approach, solution-focused therapy focuses on looking for what has worked in the past and what is working now. Oftentimes we come to therapy with stories that are highly problem saturated. It's all about what's going wrong, what's not working. And this can make it hard to see the good, the exceptions, and the solutions. So we help a client to see what has worked in the past and how that can be integrated into the present as a solution. Things that the client has tried on their own that have worked, for example. And you could elicit solutions by asking a question like, what did you do that was helpful in that moment? Or what did others do that was helpful in that moment? We also look for exceptions, and we do this by asking exception questions. So exceptions are times when the problem could have occurred, but it didn't. And so one thing that can get confusing here is what's the difference between an exception and a solution? So a solution is something that you've tried on your own that has worked, but for some reason have discontinued or haven't been using. This is something you've tried that has worked. An exception is something that happens instead of the problem, often spontaneously and without conscious intention, okay? So exception questions then help clients to see that problems are not all powerful and they have not existed forever. There have been exceptions when the problem did not exist, okay, or the problem was dealt with through a solution. Using questions like this provides an opportunity to evoke resources from the client and to engage their strengths and help them to be more aware of them. It also helps to offer potential solutions So when that exception happened, what were the circumstances surrounding it? Were there some solutions that we can now implement into the present? Questions that you could ask that would act as exception questions. What is different about the times that this is less of a problem? When was the last time things were better? What were you doing then? And then you would elaborate further on those questions. So solutions, something you've tried on your own that's worked in the past, but you've discontinued. Exceptions, something that happens instead of the problem. All right, so now let's look at the therapeutic process itself. And we'll begin with assessment. So according to solution-focused therapists, assessing problems is unnecessary because it's not needed for change to occur. They give little attention to diagnosis, history taking, or exploring how the problem emerged. Instead, clients are given an opportunity to describe their problems only so that they feel heard and understood. So you wouldn't jump to solutions without the client feeling like you hear them, that their story is validated, and that you really understand what's going on. But that's it in terms of exploring the problem. Once the client feels that they've expressed it, that you get it, you move on. There's no more exploration needed. You would then follow up with a question like, how can I be useful to you? So then the client is going to choose the goals that they want to work on in therapy. And that would be one of the first steps of therapy, is identifying and clarifying those goals. And you could question the client to help elicit that with things like, what do you hope to get out of therapy? What are your expectations for therapy? What do you want to see your future look like? And so on. Okay, so little assessment, no diagnosing, history taking, where did the problem start? Doesn't really matter. Want to understand the client's perspective of the problem, allow them to feel heard and validated, and move on. So what is your role as a therapist? First off, you're collaborative and you develop a working alliance with the client. This involves you not taking this role of expert. Remember, the client's the expert. You are there to collaborate. You're on an equal playing field. Your role is also to notice and reinforce evidence of the client's strengths, solutions, resources, and effective problem solving to show them that they are capable. You will ask a lot of questions. Much of what you do in solution-focused therapy is asking questions to elicit exceptions and solutions and strengths. And you will help the client to develop an action plan to work toward their vision of the ideal future. How are symptoms conceptualized? Well, remember that underlying reasons for maladaptive thoughts and behaviors are not usually explored in this approach. In general, solution-focused therapists believe that people develop default problem patterns based on their experiences, as well as default solution patterns. So always doing the same thing, even though it doesn't work, and being frustrated that it doesn't work. So these patterns dictate a person's usual way of experiencing the world and attempting to cope with their problems. Clients become trapped in a problem state that keeps them from recognizing the effective ways they've dealt with problems in the past, because they keep employing the same ineffective solutions and they keep being stuck in the problem-saturated story. So when people become stuck in these unresolved conflicts and problems, they're blocked from focusing on the future because they're stuck in the past and in their problems. And that would be why we see what we see. So symptoms, problem behaviors that we see in therapy are the results of these default solution patterns that are ineffective and being stuck in a problem state that keeps them from seeing their strengths and ways that they've been effective at solving problems in the past. The goals of treatment, remember that the client here is choosing what they want their goals to be based on their ideal view of what the future should look like. So the goals are going to be unique to each client. Ultimately, though, they're going to involve some way of finding and implementing solutions to the problem. At its core, the goal is to find and implement solutions to the problem. How exactly you do that, what the specific solutions are, what the problem is that you're tackling, that's going to be unique to the client, but ultimately, we want to find solutions that work. In order to help the client to develop goals that are going to be effective in solution-focused therapy, it's helpful to make sure that goals are stated positively in the client's language. So what will the client do as opposed to what will the client stop doing? For example, I will voice my expectations to people that matter to me. So it's a positive thing. What are they going to do? As opposed to, I will stop isolating myself. This way it gives them something to do, right? Something to work toward, and that's helpful. And it should be in the client's language, the way that they describe things. It should be process or action oriented, meaning that it involves action, it involves doing, and it's observable in that way. So not like, I'll stop feeling sad. Not really helpful. Structured in the here and now. Remember, we're not looking at the past and about why problems started. We're looking for things we can implement right now. At the end of the session, what are you going to start doing? They should be attainable, concrete, and specific, so observable, trackable, measurable, so that we know if the solution is working and we can track whether or not the client's doing it. And ultimately controlled by the client. It doesn't do the client any good for you to offer a solution that they're not going to do. So a goal that is developed by the client that doesn't rely on anybody else and that the client feels ownership over is going to be the most helpful. Okay? And do remember, you've got to make sure the client feels heard and validated before you move to solutions. And that's true of regular conversations too. Don't start offering solutions to fix the problem before you really understand what's going on and before you show the person that you really care about what's going on. If you jump too quick to the solution, chances are you're going to miss something important and your solution's going to fail, or you're going to make your client feel like you don't care and they're not going to be invested in the process. Okay, next, techniques and interventions. First, we have pre-therapy change, which is also called presupposing change. And this basically involves eliciting and amplifying what clients have already done to make positive change as a way to reinforce that and to show them their strengths and their resilience. This really sets the frame for therapy being a strengths-based and solution-oriented process. You're basically asking the client, what have you done since you made the appointment with me that's made a difference in your problem? Or in later sessions, what have you done since the last session that's made a difference in your problem? Even coming to therapy in that first one, like after I made the appointment, I actually came to therapy, that's a strength, right? So we're eliciting those from them. Since these changes can't be attributed to you as the therapist, it helps the client to become self-reliant, to recognize their own resources and strengths, and to avoid becoming dependent on you to solve all their problems. Now, if the client says, well, I haven't done anything, that's when you use your questions to try to elicit some kind of strength that they've exhibited or some kind of exception to the problem that you can reinforce and praise the client for. Okay, compliments. Compliments are used a lot in solution-focused therapy and basically involve validation for what the client is doing well. Okay, so we're acknowledging how difficult the client's problems are and giving the message that you as the therapist have been listening, you understand, and you care. And we're giving these compliments to help reinforce the client. Compliments in solution-focused therapy are usually conveyed in the form of appreciatively toned questions. So you're not saying, wow, you're so great. Not really helpful. But when a client's describing a problem and something they did that demonstrated resilience, you could say something like, that seemed like it was a really difficult situation. How did you do that? Right? How did you manage to get through that? And this invites the client to self-compliment by virtue of answering the question, right? And so this feels more validating for them. And again, is helping them to become self-reliant so that they don't depend on you to compliment them or to point out when they do things well, right? So a client, for example, who's talking about an argument with a friend and how it was really difficult and they felt really sad, but they listened and they apologized or whatever, you could say something like, that seems like that would have been a really uncomfortable and difficult situation to be in with your friend. How did you manage to listen through that and respond with an apology, even though it was so difficult? And then the client could say something like, well, I remembered how much I care about my friend, and that helped me to stay in it, even though I didn't want to. There you go. There's the compliment. Okay, next we have experiments. And experiments typically happen once the client has already identified some previous solutions and exceptions to the problem. We're gently inviting the client to do more of what's previously worked or to bring about changes that they've suggested that may make things better. Okay, these would be called experiments. So you're basically having the client test something out to see if it works at solving the problem or to see if it works at getting them closer to their vision of the future or their goal. One example is the do one thing different activity. And this is designed to help the client learn how to break their problem patterns and build strategies to make things go better. It has multiple steps that guide a client through changing parts of the problem and trying different solutions. And it involves a prompt and a reflection to tell the client what to do specifically, and then to reflect on whether or not it worked, why they think it worked, and what they could do moving forward. This is one of the ones that we will do in our classwork activities. Okay, the next one is the miracle question. And miracle questions help clients to envision a future when the problem is absent, hence miracle. Okay, so this is allowing the client to explain how their lives would look differently if the problem didn't exist, one in which their life is not dominated by this problem as it's been up until this point. These are nice because they help the client to identify small and realistic and doable steps that they can take as soon as the end of the session in order to start working toward that future. And imagining a future in this way can help remind clients that problems are not going to exist forever and behavioral change is possible. So a sample question that you might ask is, if a miracle happened and the problem you had was solved while you were asleep, what would be different in your life? And perhaps the client will say something like, I would wake up and I would get a phone call from my friend wishing me a good morning. Okay? Then you could explore what steps can the client take to make that happen. Okay. Another example would be if a client states, if a client states that they want to feel more confident and more secure, the therapist could then say, let yourself imagine that you leave my office and you're on track to becoming more confident and more secure. What are you going to be doing differently? And the client may say, I'm going to keep a smile on my face and I'm going to stand up straight and I'm going to not look at the floor. Well, that's something they can do as soon as they leave your office, right? And they can start practicing it. So it gives you some guidance as to possible solutions. Okay. Then we have scaling questions, which are also common in solution-focused therapy. And these involve assessing present circumstances, progress, or how one is viewed by others by using a scale of 0 to 10. These are especially helpful when change in human experiences are not easily observed, like if we're tracking changes in feelings or moods that you can't really track as well. So the scaling questions can be helpful. In essence, they involve rating something like a feeling on a scale from 0 to 10, and they can be used at any point in therapy. They can be used when you don't have enough time, perhaps, to use the miracle question, if you're wanting to gain more insight into the extent of the negative feelings, if you're wanting to assess motivation or confidence. All of those things would be appropriate to assess with a scaling question. And the sample questions are provided here on a scale of 0 to 10, where 0 is the worst you've been and 10 represents the problem being solved. Where are you with respect to whatever the problem is, like feeling confident? And the person would rank, say, a 2. Okay? And then you would ask them again at the next session. And even a move from 2 to 3 indicates improvement and should be followed up with questions like, how did you do that? How did you move from a 2 to a 3? What was different? Or what do you need to move up another number on the scale? Right? If your confidence was at a 2 and now it's at a 3, what is it going to take for you to move up to a 4 in your self-confidence? And that, again, gives you things that the client can try. If the client says, I will reach out to more of my friends, well, then you have a potential solution to try as an experiment. Okay, from now to next session, how many friends can you reach out to? And whatever, and you move on from there. Okay, consultation is another strategy that's used in solution-focused therapy and is one of the more unique strategies in solution-focused that you don't really see in a lot of others. And consultation basically involves the therapist taking a brief consultation break during the second half of the session, where they separate from the client and they reflect on what's happened in the session. And then they come back into session and the therapist compliments the client and offers a therapeutic message based on the client's goal. And it's done in 3 pieces. So first, a compliment is provided. And remember, we talked about compliments already, but we're specifically here focusing in on what the client is doing that's leading toward effective solutions. It should be encouraging. It should create hope. It should be affirming. Okay? It starts off with a really positive. Then you provide a bridge, and the bridge is linking the compliment that you've provided to the suggested tasks that you're going to be given as homework or as experiments. Okay? And the homework or the suggesting tasks can be observational or behavioral. Observational would involve paying attention to some particular part of their lives. Like, I want you to track how many times this week you feel confident. And behavioral would be the client actually doing something that you think would be beneficial, like calling the friends, for example, or walking with their head held high, something like that. And these are called suggesting tasks because we're not telling the client to do something. We're offering suggestions based on what we've seen the client do that's worked, or potential things that they've suggested as possible solutions. Because remember that the client's the expert of their life, and they are the ones who are going to be able to offer the most effective solutions because they know what has worked for them in the past. Okay, the final intervention that we'll go over are coping questions. If you haven't guessed already, there's lots of questions here: miracle questions, scaling questions, coping questions, exception questions, lots of questions. So coping questions help to demonstrate resiliency and the number of ways that a client has been effective at coping with challenges by eliciting that information. So how do you manage in the face of such difficulty to fulfill your daily obligations, for example? And the client may say, well, I take things one step at a time. That's a coping skill, right? Or how did you manage to keep your cool when your kids were irritating you? And the client may say, well, I took a couple minutes to myself and just focused on breathing. Coping skill. Okay. So that's what this is, asking questions to elicit information about how the client has coped effectively or has used solutions to manage their responsibilities. And these, again, become potential solutions. Okay, let's evaluate really briefly this approach. So some strengths of solution-focused therapy. It is grounded on the optimistic assumption that people are healthy and competent and can come up with their own solutions to reach their vision of the future. This is a non-pathologizing approach that doesn't view people as having all these problems that they need the expert therapist to fix. So this is very empowering and can feel good for a client. It focuses on possibilities rather than limitations, accepting people where they are and helping to counter pessimistic perspectives. You're not a failure, you're not an awful person, you've made it this far, you've been successful, there are exceptions, and you're highlighting those things to help the client feel competent and confident and capable. It's also brief, allowing clients to experience progress relatively quickly toward achieving their vision of the future, and providing access to clients who may not be able to afford a lot of sessions. So you can have this type of therapy in a shorter amount of time, say 6 to 12 sessions, as opposed to a therapeutic approach that requires a much longer commitment and may be out of reach for clients that can't afford that kind of therapy. There are limitations, as with any approach. Because it's short term, it might not allow therapists the amount of time necessary to fully empathize with clients and make them feel understood. Okay. Its brief nature can be challenging for some therapists to implement, specifically therapists who want to spend a lot more time developing the therapeutic alliance and would take, say, 6 sessions to work on that alliance. That's a little bit too long for this type of approach. The not knowing stance of the therapist, where they're not taking a stance of expertise, may leave some clients feeling unconfident in the therapist, that the therapist won't be able to help them. And some clients want a more directive approach. And there needs to be a bit more empirical research demonstrating its efficacy with different types of issues. And that would be another limitation. All right, that is it. It's a nice short one today. So let me know if you've got any follow-up questions or things that you need clarity on with regard to solution-focused therapy. Thank you. See you next time.